Have you ever felt your heart race before a big event, or struggled to catch your breath during stressful moments? These experiences are incredibly common, and understanding them is the first step towards a healthier life. This topic truly matters because recognizing anxiety symptoms early on is crucial for managing them effectively. By learning to identify these signs, you can take proactive steps to avoid their potential long-term impacts on your well-being. In this article, you will learn about the different types of symptoms anxiety can manifest, understand why these symptoms occur, and gain practical knowledge on how to identify them in yourself. This information will empower you to take charge of your health and embark on a journey towards a more balanced and fulfilling lifestyle. What are anxiety symptoms? Anxiety itself is a natural human response to stress, acting as an internal alarm system that prepares us to face potential threats. However, when this natural response becomes persistent, excessive, or out of proportion to the actual situation, it can become problematic and significantly impact your healthy lifestyle. Anxiety symptoms manifest in a variety of ways, affecting your body, your mind, and your behavior. It's essential to understand these different facets to gain a comprehensive understanding of what you might be experiencing. Physical symptoms are often the most noticeable signs of anxiety. One of the most common is a rapid heartbeat, where you might feel your heart pounding or racing even when you are at rest. You might also experience shortness of breath, feeling like you can't get enough air, or a tightness in your chest. Sweating, even when you're not physically active, is another frequent physical symptom. Many individuals with anxiety also report trembling or shaking, especially in their hands or legs. Muscle tension is another prevalent issue, often leading to stiffness and aches in the neck, shoulders, and back. Furthermore, the gut-brain connection means that anxiety can significantly impact your digestive system, leading to issues like nausea or diarrhea. In more severe cases, particularly during panic attacks, these physical symptoms can intensify dramatically. Individuals might experience chest pain, which can be frightening as it mimics the symptoms of a heart attack. Dizziness or a feeling of lightheadedness is also common, and some individuals may even experience hyperventilation, which is rapid and shallow breathing. Recognizing these physical manifestations is a crucial first step in identifying anxiety. Beyond the physical, anxiety also presents with a range of emotional symptoms. A pervasive feeling of dread, a sense that something bad is about to happen, is a hallmark of anxiety. Excessive worry is another key indicator, where your mind constantly races with negative thoughts and concerns, often about everyday situations. You might find yourself feeling unusually irritable, easily agitated, and quick to snap at others. Difficulty concentrating is also a common emotional symptom, as your racing thoughts can make it hard to focus on tasks or conversations. These emotional experiences can be draining and significantly impact your ability to enjoy life and maintain a healthy lifestyle. Finally, anxiety can also lead to various behavioral symptoms. One of the most common is avoidance behaviors, where you might actively avoid situations or places that trigger your anxiety. For example, someone with social anxiety might avoid social gatherings or public speaking events. Restlessness is another behavioral manifestation, characterized by an inability to sit still, fidgeting, or pacing. These behavioral changes can disrupt your daily routine, limit your social interactions, and hinder your progress towards a healthy lifestyle. Understanding these different categories of anxiety symptoms, physical, emotional, and behavioral, will equip you to better recognize what you might be experiencing. Why do these symptoms occur? Understanding the root causes of anxiety symptoms can provide valuable insight into managing them effectively and promoting a healthy lifestyle. Many of these symptoms are deeply rooted in our biology, specifically in the fight or flight response. This is an innate survival mechanism that our bodies activate when we perceive danger. When faced with a perceived threat, our nervous system releases a surge of hormones, including adrenaline. This adrenaline rush triggers a cascade of physical reactions designed to help us either confront the threat or escape from it. One of the most prominent effects of adrenaline is an increased heart rate. This is because your body needs to pump more blood to your muscles, providing them with the energy needed for swift action. Similarly, rapid breathing occurs to increase oxygen intake, further fueling your muscles. The feeling of shortness of breath can be a direct result of this rapid breathing pattern. Sweating helps to cool your body down in preparation for physical exertion. Trembling can occur as your muscles tense up, ready for action. Muscle tension itself is a direct result of this preparedness, making you feel stiff and sore. Even digestive issues like nausea or diarrhea can be linked to the fight-or-flight response, as the body may temporarily divert energy away from digestion to prioritize immediate survival needs. While the fight-or-flight response is crucial for our immediate safety, the effects of chronic anxiety can disrupt our normal body functions over time. When anxiety becomes prolonged and persistent, our bodies are in a state of constant, low-level alert. This can lead to chronic fatigue, as your body expends significant energy maintaining this heightened state. Sleep disturbances are also common, as the constant worry and physical tension can make it difficult to fall asleep or stay asleep. Furthermore, the ongoing stress of chronic anxiety can lead to increased irritability and difficulty regulating emotions. Understanding how the fight-or-flight response and the effects of chronic anxiety contribute to these symptoms is a vital step in taking control of your health and fostering a healthy lifestyle. How to identify anxiety symptoms in yourself. Learning to recognize anxiety symptoms in yourself is a crucial skill for managing your health and well-being on your journey towards a healthy lifestyle. This process often begins with developing self-awareness. One effective technique is to actively track your physical and emotional responses during situations you perceive as stressful. Pay attention to how your body feels. Is your heart racing? Are you sweating? Do you feel tense? Also, notice your emotional state. Are you feeling worried, irritable, or on edge? Keeping a journal can be an incredibly valuable tool for identifying patterns in your anxiety symptoms. After stressful events or when you notice feeling anxious, take some time to write down the specific triggers that might have contributed to your feelings and your subsequent reactions, both physical and emotional. Over time, this practice can reveal recurring patterns and help you understand what situations or thoughts tend to trigger your anxiety. It's also helpful to be aware of common triggers for anxiety. These can vary from person to person, but some frequent examples include public speaking, social interactions, financial worries, work-related stress, or major life changes, such as moving, changing jobs, or relationship difficulties. Recognizing your personal triggers can help you anticipate potential periods of heightened anxiety and develop coping strategies in advance. It's important to understand the difference between normal stress and anxiety disorders. Occasional stress is a normal part of life and can even be motivating in some situations. However, chronic anxiety is characterized by persistent and excessive worry that often interferes with your daily life, relationships, and ability to function effectively. If your anxiety symptoms are frequent, intense, and significantly impacting your ability to pursue a healthy lifestyle and enjoy everyday activities, it might be a sign of an underlying anxiety disorder. Learning to differentiate between typical stress and more problematic anxiety is a key step in knowing when to seek professional support for your health. When to seek help. While learning to manage mild anxiety symptoms through self-help strategies is beneficial for a healthy lifestyle, it's crucial to recognize when your symptoms warrant professional intervention for your health. Certain severe symptoms should prompt you to seek help from a healthcare professional. Experiencing frequent panic attacks, which are sudden episodes of intense fear accompanied by overwhelming physical symptoms like chest pain and shortness of breath, is a significant indicator that professional help is needed. Similarly, if you experience constant and uncontrollable worry that dominates your thoughts and interferes with your daily functioning, it's time to reach out. If your anxiety leads to significant avoidance behaviors that limit your social interactions, work opportunities, or ability to engage in activities you enjoy, seeking professional guidance is essential. Changes in sleep patterns, appetite, or significant difficulties in concentration that are linked to your anxiety are also reasons to consider seeking help. A healthcare professional can provide a proper diagnosis and recommend appropriate treatment options for your health. They may use various diagnostic tools to assess your anxiety levels and determine if you meet the criteria for an anxiety disorder. Some commonly used tools include questionnaires like the Beck Anxiety Inventory, BAI, which measures the severity of your anxiety symptoms, or the Social Phobia Inventory, SPIN, which specifically assesses social anxiety. These tools, along with a thorough clinical interview, help professionals understand the nature and extent of your anxiety and develop a personalized treatment plan to support your journey towards a healthy lifestyle. Remember that seeking help is a sign of strength and a proactive step towards improving your overall well-being and health. Managing anxiety symptoms. Developing effective strategies for managing anxiety symptoms is a vital part of maintaining a healthy lifestyle and improving your overall health. There are both immediate coping strategies that can help you navigate an anxiety episode in the moment, as well as long-term management techniques that can reduce your overall anxiety levels over time. For immediate coping strategies when you feel anxiety rising, techniques like deep breathing exercises can be incredibly helpful. Slow, deep breaths can help to calm your nervous system and reduce the intensity of physical symptoms like a rapid heartbeat and shortness of breath. Grounding methods are another effective immediate strategy. These techniques involve focusing your attention on your present surroundings using your senses. For example, you can try naming 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. 1. This can help to distract you from anxious thoughts and bring you back to the present moment. For long-term management of anxiety, incorporating certain lifestyle changes can make a significant difference in your health. Regular exercise has been shown to have a powerful impact on reducing anxiety levels. Physical activity releases endorphins, which have mood-boosting effects and can help to alleviate stress and tension. Mindfulness practices, such as meditation or yoga, can also be incredibly beneficial. These practices help you to become more aware of your thoughts and feelings without judgment, which can reduce the tendency to get caught up in anxious thought patterns. Prioritizing healthy sleep habits is also crucial for managing anxiety. Getting sufficient and restful sleep allows your body and mind to recover and function optimally, making you more resilient to stress. By incorporating these immediate and long-term strategies into your life, you can effectively manage your anxiety symptoms and cultivate a more balanced and healthy lifestyle. Conclusion. In summary, anxiety symptoms can manifest in various ways, including physical sensations like a rapid heartbeat and shortness of breath, emotional experiences such as dread and excessive worry, and behavioral changes like avoidance. These symptoms often stem from the body's natural fight-or-flight response and can be exacerbated by chronic anxiety. Developing self-awareness is key to identifying these symptoms early on, allowing for timely intervention and management. Remember that anxiety is a manageable condition, and with the right tools and support systems, you can lead a fulfilling and healthy lifestyle. Don't hesitate to seek professional help if your anxiety symptoms are severe or significantly impacting your daily life and health. We encourage you to share your experiences or coping strategies in the comments section below to foster a supportive community and help others on their journey towards better mental health.